Hey there, it's Dr. Jim Collins. Thank you so much for taking a little bit of time to stop by and watch my short video. We try to put one out every single week on some really good topics. This time I'd like to talk a little bit about diversion and substance abusing healthcare professionals. Let's start with the question, what is diversion? It's becoming more and more of an issue around the United States in healthcare. Is diversion stealing, removing, or wasting drugs, prescription medications, including some very dangerous ones? As we know, we have an opioid crisis all around the country. So is diversion taking these drugs, these prescription drugs, from one's place of employment? And it seems like that's the explanation that I'm getting. Places like hospitals, skilled nursing facilities, assisted living facilities, and it happens in home health as well as hospice. These drugs can be taken off-site or used later, and obviously sold later as well. They can be taken at work, which is something completely dangerous. It's a completely different topic. We're now talking about impaired healthcare professionals. Impaired medical healthcare professionals taking care of residents or patients or clients. So having impaired healthcare professionals providing services or care under the influence of drugs is a terrible, terrible thing. But let's talk about the scope of the problem. How widespread is this? It's pretty big. Substance abuse is the primary reason for disciplinary actions against nurses by state boards. I don't want to pick on nurses, and I don't need to do that. I'm just sharing some statistics with you. According to the American Nursing Association, up to 10% of nurses are drug dependent, and that's a very high number. That means 1 out of every 10 that are working. Nurses are not alone, though, unfortunately, with this problem. 8% of physicians, 15% pharmacists, and others also divert and abuse drugs in healthcare. So you might ask, what exactly besides opioids are they stealing? Fentanyl, which is a pain medication, is the most common target out there. Why is it such a target? Because it's effective. It produces a very powerful high. It has a very short duration. It's also very dangerous for its overdose potential. Other drugs stolen include the following: codeine, oxycodone, morphine, Percodan and Percocet, Dilaudid, and Darvocet. Some healthcare professionals prefer amphetamines or benzodiazepines over pain medications, and some are stealing psychostimulants, the ADHD drugs. So in closing, there's a lot more information about this topic, and I wrote an article on it, and I write articles on a lot of different things, but you could find the article on my blog, drjimcollins.com, including, for instance, I write about why don't we hear about this topic very much, what are the signs of diversion, and much more. So go ahead and click the link to my blog. And if you're a licensed healthcare professional and you would like CEUs on this topic,